Abir, I want to ask you, since the treatment, as everybody says, can be up to 6 weeks to 6 months to maybe a year. So isn't that a challenge for the doctor as well as the patient on some level as well, to continue that dosage and be particular about taking their medicines and treatment on time? Because sometimes, like, I know it's human tendency, patients just lose their will to continue, I should say.
Yes, it is, and it is the biggest challenge we face in treating chronic urticaria, because it is kind of counterintuitive, and we have to explain this to the patients, that even if you are completely okay, completely hive free, there is no itching, no lesion happening, why you should continue to take that tablet or those number of tablets day in and day out with regularity for a few months beyond being completely okay. So this is a concept, this is the essential concept that we need to get through to every patient of chronic urticaria. I think one thing this panel would like to make very clear to the public from this is that antihistamines, especially second generation antihistamines, are probably the safest medicines in modern medicine that we have.
Including cardiac safe. Yeah.
They can be taken for simply years or decades together without causing any adverse effects.
Unlike many other chronic diseases, we don't have a blood test which will tell us this is how bad your disease is, this is how long it's going to last. So the counseling part is what most of us have been talking about, is extremely important. So we need to counsel them, and the way I do it is I tell them it's like diabetes or blood pressure. You need to take this tablet even if your BP is normal, even if your sugar is normal, you're going to take your tablets. So don't stop it without checking with us. The advantage of this condition over conditions like diabetes or urticaria or hypertension is that here at some time, maybe in the near future, which means 6 months to 1 year, we may be able to take you off medications. And that's a big advantage here. So we need to make them think positively.
So it's a mindset change that has to completely happen.
It's very important to change this mindset, adding to what Dr. Murli and others said, I must say. We all strongly feel that urticaria is a problem which is being treated by not only dermatologists, by pediatricians, by physicians, by general physicians and many other specialists. And many a times we see that antihistamines, they have been explained that you cut short after 2 weeks or 3 weeks, then this is fine. I think this type of awareness is not only for the patients, but also for non-dermatologic physicians also. In other specialties, for any kind of allergy, the concept of antihistamines is not beyond few weeks or maximum few months. But here there is a condition like chronic urticaria where you have to give antihistamines at least for 6 months or 1 year or even for 4, 5, 6, 10 years down the line.
With diseases in India, there are many myths attached. So, Dr. Godse, I would like to ask you that, what are the kind of myths that you often hear when patients suffering from chronic urticaria come to you? Because I think most of them are not scientifically proven.
Yeah. See, most of them that they feel that urticaria is something I've eaten, that's why I got allergy. Remember, chronic urticaria is not truly an allergy. Right. It is an autoimmune disease, as all of us know that there are autoantibodies in the blood which keep on causing the release of histamine and urticaria. So, most of the time people try to stop this food, that food, not take non-veg, not eat it and try this thing, but ultimately they don't succeed. Typically, it is not that food which is the cause of chronic urticaria.
Yeah, the patient comes and asks you, kisse hai? Mere ko kis cheez se hai? Now, this is what it is, it is nothing from outside, it is from something from within.
Your blood is your own enemy, that is what we tell you.
It's very tough to explain that to a patient.
No, but we can explain in very simple language. All these myths, they generate from a local, different regions, like in West Bengal. I am from West Bengal. I can tell you the local name for the urticaria is ambat. Am means mango. How it is actually the local culture, how these things have come out actually, and they give a scientific stamp to it because they are eating mango, so that's why they are getting these hives or itching. So all these things are there. Many people have the concept that this is because of worms actually, and they give previously they used to give deworming. Even lot of physicians, the general physicians,
even now,
family physicians, they give
even now
anthelmintic.
See, it's human nature to try to find a cause,
an easier cause that
cause,
you don't
identifiable cause which you can pinpoint and blame.
Always.
So in fact, it's like your own border security force acting against your own self.
So the biggest message that we try to give out is that chronic urticaria is not allergy, whereas acute urticaria often is allergic.
Right. So, you were talking about how is it a challenge to convince patients to continue their treatment for that long. I want to get another challenge that is there perhaps, which is awareness. There is either lack of awareness, or rather I should say no awareness about the different types of urticaria, and the moment you hear the word urticaria, you get scared. Why is there lack of, awareness about something like this, which is so common?
Nobody can escape living on this planet without getting a bout of urticaria or two in their lifetime. So people talk about it. People have been talking about it for generations. And so now to tell them that no, the cause is within you, the cause is not outside, and you need to take medicine for a long period of time. The medicine is safe, it doesn't cause side effects. These are the odds we fight against.
I think the problem is also about too much information available to the educated masses to read, so much, and don't know what applies to them. And so that Google syndrome.
We call it Googleitis.
Googleitis.
Inflammation due to Google.
They read first and then they come to you. And if they are unable to decipher themselves, then it's the time that they come to your clinic. And then they're almost like testing you, whether you're saying right or wrong. And if you almost, if you tell him something which is going against the Google, he almost, especially this is very common in a youngster. And then they start believing that what I've read, he doesn't know, so it's very difficult to convince him at that moment of time whether how to do it,
I face this problem. I am sure that all of us face this problem very often.
Most of us over here have formulated guidelines. We've been part of guideline committee groups and all that. They're all available on the web. So we need to give them authentic sites where to go and look at it and convince themselves if they are in any doubt.
Let's not send one message that this disease is incurable.
Absolutely.
Let's not send that message through this web, this cast that we are doing right now. I think it is controllable.
Very nicely controllable.
It is nicely controllable. You can lead a normal life, and I think that needs to be fully and strongly
endorsed.
Endorsed.
And the medicines are safe lifetime, Our allopathy medicines are safe.
Medicines
They
are
can be taken
absolutely
as long as you
We
want.
have medicines beyond the standard medications.
Yes.
So now that we've touched upon pretty much every aspect of chronic urticaria here, I just want to know if we could crystal gaze into the future, how do you think the future of ICU management looks like in terms of research that is available, in terms of the patient knowledge, the doctor-patient interface that is there currently?
As on today, urticaria, the incidence is going to go high and high. It is 1 to 2%, it might go ahead, but there are newer medicines available, something known as biologics, which actually controls the root cause of disease, which are already coming to market, which are FDA approved. So the newer medicines will come in the market, which will actually give a long remission and good control of the disease. And obviously, more and more research is being done on this disease, so we are going to get newer and newer medicines for sure.
About research, actually, I want to know. That's something really important that
You
I
see,
think.
even Dr. Gotse mentioned about biologics, but now as you keep using a biologic, you realize there are some patients who don't respond to a biologic, which means there is something about the mechanism of production of urticaria which we are not touching today. So that is one of the key areas of research, and that is a very big area of research going on today.
Focused education and training on these areas, which are so-called grey areas in our undergraduate curriculum, MBBS, is to be given. Then only, if we start from the very base, then only those who are becoming graduate professionals in our profession, MBBS doctors, they will be knowing enough to handle urticaria at their level. And only at the second phase, they will send their patients to a specialist. The patients will be benefited immensely.
On a closing note now, since we are out of time, I would just like to have one last key message that you would like to give to our viewers on, the management of chronic urticaria and how they can go about it.
I think the most important thing that I would say is that chronic urticaria is something treatable. We have drugs which are available to give a better quality of life and give you relief. With good second generation drugs like fexofenadine, which is totally non-sedating, does not interfere with your lives in any way. Then there are other drugs also which are available, something like cyclosporin, something like omezulimab, which is now available, which can also be used with good success rates in future.
The patients specifically, don't stop your medicine. Don't stop your medicine until your doctor tells you to stop it. That is the single most important message. Don't even reduce the dose until your doctor tells you to reduce it. And if you do that, there is a very, very good chance that you'll be able to get rid of chronic urticaria in time if you take it with discipline and take the right medicines.
Dr.
Yeah,
Bhatt, sir?
again it's you have to take medicine regularly till your doctor tells, and don't stop suddenly. That is my message.
Dr. Murli.
In spite of all this, we as doctors recognize there are unmet needs, and there is phenomenal research going on, and in the next 4 to 5 years we are going to see even better medications, more effective to treat urticaria and improve quality of life. That is a statement which I think we should stress upon.
Sure. Dr. Sandeep.
For chronic urticaria, the treatment with second generation antihistamines needs long term treatment in terms of months, in terms of years. Don't be panicky about the adverse effect of it, because when a specialist doctor writes it, he writes with a lot of responsibility. Don't reduce the dose, don't quit it, don't go by the advice of your neighbors or friends who give free advice.
So, so clearly it is curable. Take your medicine and dosage on time. Don't panic. And awareness is key, but the right awareness is more important. So on that note, I hope that we all have helped our viewers understand what chronic urticaria is all about and how it can be managed more effectively if you are precise and there is timely dosage. Thank you so much, and I thank the illustrious panel to be with us here in our studios today. Thank you.
Thank you.
Thank
Thank you very much.